I have never seen anybody respond to another professional like that.
Oh, it gets hot. It gets heated.
Man, pretty unprofessional.
We're here today reviewing and critiquing common medical shows.
Are you taking any pain medication?
No, why?
Your urine tested positive for opiates.
What do you mean?
You know what I mean. You're taking drugs, which means your baby is taking drugs. What is it, codeine, heroin?
I'm not using drugs.
If you're sharing needles, you're putting both you and your baby at risk for hepatitis, HIV, endocarditis.
I'm not sharing needles.
But you are using. Meg, I know you care about your baby.
I do. I do care.
You don't want to hurt it, do you? Then you have to stop.
I'm hardly using. Just a little. Just so I don't get sick.
You can't use at all. Let me put you into a detox program and help you get clean. Okay. I'll see what I can do.
I feel like that interaction between the nurse and the patient was way too easy. I've never seen one go that easy before.
A lot of times labs don't lie, but patients and people may lie to you.
She made an assumption. All she had to do was say your urine is positive. In order to get the truth out of the patient, let the patient talk. That's what we're teaching our students now. So she dragged everything out the patient. The patient said yes just to get her out of her face, which is not uncommon, because I can almost potentially see her having gotten up and left.
Dr. Myers.
Carol.
Hi. I have an expectant mother in need of a rehab bed. Any way you could see her?
Sure, but I just gave our last spot to a guy in exam 1.
She's pregnant.
I'm sorry, we only have so many spots. I can sign her up for an outpatient program until the space opens up.
Is there any chance you could sign the guy up for an outpatient program? I mean, we're talking about the welfare of an unborn child here.
Let's see what we got. Where is she?
Thanks, in here.
If she's a seasoned nurse, she's seen these scenarios probably play out based on what she knows and her wisdom and knowledge. She went and talked to the psychiatrist directly and reprioritized the needs. If it was for the greater good, then sometimes everybody can't be happy.
Dr. Lawrence, could you see a possible CVA in exam 2?
Ask Carter. I gotta finish these charts.
You took my spot.
What?
My patient's detox spot.
Oh, Dr. Myers said he could be an outpatient.
After you convinced him.
Yeah, well, we needed the spot for a pregnant woman. If she doesn't get off heroin, the baby will be addicted to
You can't do that. You're a nurse and I'm a...
You're a what? You're a med student. I didn't know he was your patient. I'm sure he'll be admitted as soon as there's an open bed.
That's easy for you to say. You got the bed.
Fighting for beds, that's real. We need this bed versus that bed. Who needs it more, the lives of 2 or the lives of 1?
I have never seen anybody respond to another professional like that. The interaction between the healthcare providers is pretty unrealistic. Most of them work as a team.
So when she first walked in the room, she was a little bit mean, but then she did sit down next to the bedside and talk to the patient. And good for her for advocating, but just, the way she did it was pretty unprofessional. Talking to the med student that way. We work really collaboratively with providers, and so we want to, really speak more professionally, even in tense situations like that. I mean, I've been in some of those situations in the ER, but you just want to make sure that you have a good professional relationship with all of your staff.
A lot of times those med students, especially when they first get into the hospital, are going to depend on nurses for what they, what's this? Where's this? What should I do with this? Or in this scenario, well, you do this, and then this.
Oh, it gets hot. It gets heated. I think it's very much on point. I think it's very relevant about what we see. Yes, she is on point, but is she on point in order to be successful with the patient and the unborn child?